Now, please join me in welcoming Dr. Garth Graham, Vice President of Community Health and Impact with CVS Health. Dr. Graham has a passion for healthcare equity that became a mission for him years ago. His message: empower individuals, families, and communities to see real improvements in social determinants of health. Thank you so much for joining us, Dr. Graham. I wanted to, start out. We've had a lot of folks today talking about innovation in the space, telehealth, all of the new things that have kind of plopped into our lives that we've been shoved into a very different world. And I'd love to get, your take for the moment on whether healthcare equity has been improved or not by any of the innovative stuff that's gone on, or have just the people that have all of this gotten more?
Yeah, I don't think we know enough to say whether it's improved. We know right now that COVID-19 continues to devastate African American and Hispanic communities across the country. So right now, I don't think we're really seeing the mega effects of that yet. But what we do know is that these strategies, and there are a number of different strategies that we're employing, others are employing, can work. And the goal is really to see this impact and effect take over time. But right now, COVID-19 really just continues to have a significant impact on Black and Brown communities.
What can we do?
Well, there are a couple of things. COVID-19 did not happen in a vacuum. There were a number of things that were happening beforehand. There are a number of things that have brought us to this point. The social determinants of health, issues around housing and multifamily generational homes and the lack of people to socially distance. The fact that you have an overrepresentation of Black and Brown communities in essential workers and the kinds of things we need to do there. And so there are a number of things, and of course the issue around chronic diseases in minority communities is particularly important. So there are a number of factors that led us there. What we need to think through now, the first thing we need to really get to is testing. Making sure we're getting adequate testing in terms of Black and Brown communities across the country. We're leading some efforts around that, and it's something that we're very passionate about. I'm very passionate about. But the first thing we got to do is testing, and then we have to remember about the impact of chronic diseases on these communities across the board, which continue to be an issue to this day.
Maybe this is an unfair question. We've had so many people raise testing today. The importance of it, whether you're in industry, you're in schools, whether you're, in your communities, and just needing it more instantaneous, the results, and just more ever-present in our society. When you hear the President of the United States say, hey, we're doing too much testing, we need to back off, we're testing too much. I know you're in industry, and you may not be able to say anything, but does it make you crazy? Does your hair, does your hair go on fire, when you hear that kind of comment, that we've got too much testing?
Sure, there are a lot of things happening these days that have what little hair I have on fire. And so there are a lot of challenges. What I can tell you for sure is that we do need to continue to get testing to Black and Brown communities. Some of the things we're seeing in terms of our community testing sites, we launched a number of community testing sites across the country, working with free clinics and other associations that are on the ground. And what we're seeing is there's a need. We're seeing where folks are responding and they're showing up for testing, and we're seeing positive rates that are concerning. So I would say that for sure there continues to be a need for testing within Black and Brown communities, and it's an onus and responsibility on all of us to make sure we get it there.
Now let me ask you another unfair question. We had CDC Director Redfield on earlier, and I asked him about the schools and the guidance and whether, because I interviewed him recently, and it was right after the day that they were pulling back their guidance on something else, and he responded by saying, hey, we provide guidance here. He went kind of into micro guidance about all the different, but it occurs to me that a company like CVS Health, you know a lot. Why are you basically issuing things out? If you want to have a safe school, if you want to have a safe environment, can the private sector stand up where the public sector is confusing or confused?
I think that's a great question, Steve. In fact, the private sector, us, other organizations have stood up, especially around this issue around testing. It's best to work hand in hand with the federal government, and I think that's what we're doing in efforts like this. I do think there is a role for leadership in a variety of different aspects. The best kind of leadership is when we kind of all come together and kind of get on the same page and move forward. And you're seeing a lot of that, with COVID-19 in terms of private sector and federal government collaborations. But, we never want to step ahead of the role of the CDC. The CDC has continues to have, great leaders within the organization. So we want to be able to work with them and support the mission and the goals of organizations. I mean, like the CDC, FDA, et cetera.
Garth, I know you work with a lot of different communities and community access, but one that's been close to me is, the 65+ community, elder care facilities, nursing homes. That's another vulnerable community that has been very much targeted and, and in my language, being murdered in many cases by this virus. What are the kinds of guidance and the sorts of steps you think are important for us to understand there?
Sure. Again, testing within nursing home communities is particularly important. That's again, one of the efforts that we're deeply involved in. The other kinds of things is to make sure certainly that those healthcare workers and the folks who are working within that environment, they have sufficient protection and are able to do their job sufficiently. And again, going back to this issue of Black and brown communities, a lot of frontline workers, essential workers are folks that are represented in those communities across the board and kind of helping to keep our nation afloat, not just in nursing homes, but in different ways. That's why, Steve, it's important. Again, I kind of mentioned this earlier, and I think it's a part of the passionate efforts that we are engaged in. Efforts to reach and target these disparities have a lot of different dimensions, but we have to be thoughtful. We have to reach communities where they are. We have to be flexible in terms of how we reach essential workers. And I mean, for us, we've found a lot of these kind of partnerships and community organizations, free clinics, community health centers, and folks along those lines to be essential to reaching a lot of those essential workers who may not have 9 to 5 hours, but need to be reached and tested as well.
The last area that I'd love to get your insights on, because I know you've been working on it with the Aetna Foundation. It's come up earlier as, discussing the state of mental health in America, mental health during a pandemic. I was very, probably not the first time I thought about it because it's just on my mind a lot, but a while back when I interviewed the mayor of Miami, Francis Suarez. Francis was diagnosed with COVID, I think in late February, early March, after he'd visited Washington, D.C., actually. And it was a powerful interview to see what he'd gone through. But he said, look, this crisis has pushed people indoors, and we have lots of domestic violence that we may not be knowing. We may have suicides we don't know about. We have mental health tensions out there. And he was telling people, get involved, be connected. Even though you may not be able to be people to people, you got to be connected. And so I know that mental health really matters to you. And I just, and just in closing, just kind of get a sense of what you're doing and what we all can do to make this time of, incredible tension less deadly to people, if you will.
Exactly. So what I often say, social distancing does not mean social isolation. There are a number of folks, particularly elderly folks, but others who are getting isolated. And the other thing I'm worried about, Steve, when we think about mental health, is certainly the younger population and the pediatric population and the things people are being exposed to. So we have funded a number of efforts working with communities across the board to tackle this issue of mental health, and also looking within our own workforce and how do we make sure we provide access to mental health and deal with these challenges. And we've reduced co-pays and done a number of financial incentives to make sure mental health is dealt with aggressively. Steve, one very important point to understand: mental health, chronic diseases. Another thing that's burgeoning is 60% of people have been delaying care for chronic diseases through the pandemic. And so you have heart attacks, strokes, cancers, different things that are going undiagnosed right now because of fear within the pandemic. And we launched one particular campaign called the Time for Care initiative to really target, people getting back to focusing on themselves, understanding the importance of primary care, understanding the importance of, continuing to take care of your chronic conditions, mental health being one part of that, but also your other chronic clinical conditions during the pandemic. And we got to make sure we get that message out to people.
Garth Graham, will you promise to come back and spend time with us again? Because you're fun. I mean, you're fun, even though it's kind of a tough subject, but it's interesting, and I really enjoyed our conversation. But Garth Graham, Vice President of Community Health and Impact at CVS Health, thank you for joining us today.
Thank you.